Hello guys, hello family, hello friends. This is Dr. T. Once again, welcome to Clinical Medicine with Dr. T. So guys, yesterday we did talk about mental health, and I focused more on the students. So and I said I was gonna do part two. I was gonna do part two of this kind of an awareness kind of a thing. And guys, I'm sorry that I have to talk about these things. I feel that, especially as a student, you become excited that you're studying medicine, you're gonna be a doctor, you're gonna be helping people, and all of that. But there is no one that really prepares you um, for for the work environment. There's no medical school that will ever prepare you um, for the working environment. There's no one. There's a lot of things that happen that happens there. And and guys, I'm gonna try and choose my words very carefully because I don't want to sort of like inject you with some kind of fear. But I mean, guys, let's be honest. There's an elephant in the room. There's an elephant in the room, and how many people are willing to engage and talk about it? I mean, as I was thinking about this thing, I shared a story yesterday about three registrars that committed suicide in one of them hospitals in America. About three of them that committed suicide in the space of, I think, 6 months or 3 months, something like that. So I mean, we spoke about what I read. I did tell you guys about what I read from that article, the reasons that were being put forward. One of them is like these horrible working hours. Yes, they are horrible. I know here is that we are still working hard. We are still being overworked, and because I mean, if you're gonna be working from 8 to 4, and because there's less doctors in that unit, even though you're working 8 to 4, you push yourself um, to make sure that you do everything on that day, and that work is supposed to be done by 4 people, but you are only two or you are only three, something like, or you are only one. We are still expected to cover the work. One thing that people will not say, doctors that committed suicide, they, like I said, they were complaining that their consultants would ridicule them. They would make them to feel small. They are forever not pleased with whatever that they were doing, even though these doctors would try their best. They got the longest hours. They were the forever criticized. The issue of unfairness in the call roster and also in how work is distributed and all those things are there. They are real. So, one thing that I hope the guys that are students now and interns and also medical officers who are listening to me now, I hope that guys will be different registrars and different consultants. As a consultant, when you guys become consultants, never be a reason for someone to get depressed. Never be a reason for someone to have their pregnancy, to miscarry their pregnancy because of your harshness. These things are happening, guys. There are registrars that have lost pregnancies because they were put, no one is willing to understand them at work, that they are pregnant. They are put in I mean, it happens, guys. It happens. It's there. It happens all over South Africa. All over South Africa. So never be a reason for someone to take antidepressants because of you. Never be a reason for someone to commit suicide because of you, just because you are a consultant. I mean, guys, what is this? What is all this? I mean, I mean, guys, you are a consultant and you are so hard on your registrars. You embarrass them in front of the nurses. You embarrass them in front of the students. You know what happens when you leave after the rounds as a consultant? What happens is that registrar that you embarrassed in front of the juniors, his or her juniors, doesn't have courage again to teach the students. That's the sad thing. Because as a consultant, you are not always there. You attend meetings, you are busy running the department, and you're not physically there. Yes, consultants, they do come and see patients, but most of the times they're not there, which is understood. But the people that are left are registrars. Now, if I'm a registrar, I'm going to be embarrassed in front of the students and the nurses, and I'm expected now to give orders to this same nurse that I was embarrassed in front of. It's not an ego thing. It's not really an ego thing. It's not about ego. And I'm expected now to teach the same students. Will they listen to me, those students? Will they trust the information that I give them? Will they respect me? Will they take me serious? Because I've just been embarrassed in front of them. That's why you find that in some places or in some departments, students do not learn because the medical officers, the registrars, they've been embarrassed enough. They don't even have courage to teach anymore. And the students are there not learning anything because of this environment that has been created. I feel it's so unnecessary. I feel it's so unnecessary and it's so depressing. So guys, all I'm trying to say is that when we go on and become specialists, please remember this. Let no one hate medicine because of you. Let no one leave medical practice and go and start a business outside of medicine because of you. Rather help the person, rather be there for the person. You know, as an intern, as a student, one of the reasons why I have this channel, I made a promise to myself. I said, there is no student that is gonna be with me as a doctor that will not learn from me. There's no way I can be on call with a student and they don't learn anything from me. There is no way, because I mean, students do not get paid. The only way of paying a student is teaching them, giving them information, helping them in their studies. That's the only currency that speaks to them, because they don't get paid. I mean, there is also I want to say this to the interns, MOs. I mean, if a student comes in, they leave their residence, they come for a call, let them leave with something. Let them learn something other than having them do bloods and walking up and down the hospital, following you when you go to x-rays, following you when you do this and that, and then they don't learn anything. So I made a promise to myself that it will never happen as long as I am there. That's why I started teaching students as an intern. I mean, people have been wondering what kind of an intern is teaching students, because not all interns do it. But for me, it's a personal thing that I said to myself that it's not gonna happen. When I am there, they will learn. So then, yeah. So yeah, guys, that's that. No, doctors, they hardly have lunch. They hardly have lunch. I mean, this thing of leaving at 1, come back at 2, and have lunch for an hour doesn't happen in medicine. Like, it just doesn't happen. You don't want to sit and rest when you know that you need to do A, B, C, and D. So that's why they would be snacking in between patients, all those things. I mean, that's how it is, guys. It's so exciting because when you start, it shows that you are really there for the patients, but it gets to a point whereby it's too much, because it just continues. It doesn't stop, it just continues. You know, guys, may his soul rest in peace before I speak about him. You know, Prof. Mayosi, who was the dean in UCT, a cardiologist, Why would someone who's doing so well in his life commit suicide? I mean, we looked up to him. I mean, the day I learned of his passing, guys, I was so heartbroken. I was so heartbroken because, I mean, as the young upcoming doctors, um, black doctors, we were really looking up to him, and we still feel that, I mean, he has been stolen away from us, because he was one of those people that, I mean, I aspire to be a cardiologist myself. So it was heartbreaking, guys. It was heartbreaking, and it's the same things that people do not to address. It's the same things that people do not engage. I mean, it's about the mental health. It's about the mental health, and I mean, guys, that's why I want you to learn to take care of your health. Learn to take care of your health. Learn to take care of your mental health, because there is no one who's going to do it for you. The department will not do it for you. Your seniors will not do it for you. Your seniors, they want you to be at work. Your seniors, they want you to do the work, because your senior is probably afraid of his or her senior. So you are there, down there on the chain. So that's why most people are specializing now. You know, majority of the people who are specializing, they are trying to escape the bullyism that happens in the workplace, because they know that once you become a consultant, yes, a lot of people are going to be listening to you, not that you'll be one taking orders from them. In that way, you can be spared from being bullied. So that's why people are like, I have to go and specialize. I have to go. I have to live and specialize, because, I mean, guys, it's so sad. It's really, really so sad. The thing is this. Oh my God. It's so sad to hear about the passing of a young doctor. It's so sad. Guys, I'm not saying I'm spared myself. I'm going to share my stories with you now. I'm not spared. We are human beings. We take the pressure, we take the stress just like any other person, because we have the same anatomy as patients. We've got the same. The difference is that we studied medicine, but I mean, the neurons that they have are the same as that we have. The neurotransmitters that they have are the same that we have. So, guys, we are not spared from these things. So I think what I wish is that as you guys continue with your medical school, try and learn to take care of your mental health. Try so that by the time you are an intern, yes, there are interns that have committed suicide. There are interns that have been involved in accidents and then they actually died because some of them, they were covering for so and so, they were tired and they tried to drive back home on a Saturday morning, on a Sunday morning. You hear those stories and they're so heartbreaking, because this is someone they were not there for themselves, but they were there for the patient, and they died while executing their duties, and there is no one who really, I mean, guys, why should young doctors, why should doctors die before someone really take this thing, take it seriously? Why should we be losing doctors year in and year out because of mental health related issues? Why should it continue? Guys, I struggle to understand. I really struggle to understand this. Okay, so this thing is disturbing me, guys. It's really disturbing me. The more I just think about it, the more I talk about it, it's disturbing me a lot. You know, once you leave medical school and you become an intern, you are gonna have these moments. Guys, be prepared. It's gonna happen. It's gonna happen. It's going to happen. You are gonna have your depressive moment. It's going to happen. That's why you should learn to cope. You should learn, anticipate, so that you can have good coping mechanisms. Because you know, they push themselves to drugs. They push themselves to alcohol as a coping mechanism, and we know what happens with drugs. There's a doctor that I've recently learned. I read about him that he has been prescribing a pethidine for himself. It's somewhere in Gauteng. This guy's been prescribing pethidine for himself and has been only alerted. I don't know if it's HPCSA or what. And then the guy has been, his story, his case now is with HPCSA. So if you can go back and check, why did this doctor end up engaging in drugs the way he is? Guys, it's not a secret. If you go to hospital, you will see that, you will realize that there are drugs that are only given by a sister who always keeps the key by herself. Because it's known that there are doctors who end up using drugs as a coping mechanism. It's not a secret. It's not a secret. It's happening. Why does a sister and nurse fuss so much when you don't? You cannot prescribe pethidine using your mouth. You can't tell sister, give me pethidine there. You cannot prescribe benzodiazepine by mouth. The nurse will want you to bring the chart, the name of the patient, the dose that you want, and all of that, and all of that, and all of that, and all of that. So those drugs are controlled because it's known that healthcare professionals, not only doctors, there are those who are abusing the drugs. There are those who are addicted to the drugs. It's known. It's not a secret. It's just something that is just known. So if you can go back now and look at the case of these doctors, why did they end up doing this? You will know that it's because of these things. It's because of these things. The third thing, it's very easy to strike someone off from being doctors, strike them or take their license. It's very easy to do that, but it's not so easy to go and actually check, why did this person, why are they ending up here? Why are they like this? Why are they behaving like this? Why would the same system that we work for, the same system that has consumed us, is the same one that will sort of like vomit us when we have got issues. That's why it's important to take care of your own health. That's why it's important to make sure that the things that bring you positive energy, you focus on those things. And yes, never neglect your family. Your family is your big support structure that you have. Your wife, your kids, the other businesses that you have, they will give you positive energy. Keep them. So guys, this is just my second year of internship, and I've made these observations very quick. I've identified them already. So it's really a mess, guys. And remember, as a doctor, you are employed today. The minute you can't practice, they're gonna not find any issues replacing you. As a doctor, you are replaceable. I'm leaving internship next year. There's gonna be an intern who's gonna be doing exactly what I was doing. So you are replaceable. So when you are not there, when you have died, when something has happened to you, it's just the system. They will put someone in there quick, within a day, within a minute, they will put someone there. So, I mean, you need to take care of yourself. You need to take care of your mental health. So guys,